All right, future nurses, get ready, because today we are diving deep into something you will be using every single day of your careers.
Nutrition.
That's right, nutrition. We are going to go way beyond just like the basic definitions today, though. This deep dive is about connecting those fundamentals to real-world scenarios.
Yeah.
You know, the ones that you'll encounter as nursing students and later on as licensed professionals.
That's right. We're talking the nitty-gritty.
The nitty-gritty. We've got some interesting cases to help us with this deep dive.
Oh.
We've got Susan, a pregnant nursing student. She's struggling with her own nutritional needs right now.
Yeah.
And then we've got Charles. He's a caregiver for his wife, and she has dementia. So we'll be thinking about these cases as we go through all of this information.
These cases really highlight how your nutrition knowledge will make a difference for your patients.
Totally. So to get started, let's talk about this big idea with nutrition.
Okay.
It's not just about what we eat.
Right.
It's how our bodies use those nutrients. And those needs change.
Throughout our lives.
Throughout our lives, exactly.
Yeah.
So let's start at the very beginning. Newborn babies.
Yeah.
For a good chunk of time, breast milk or formula is their only source of nutrition.
It is the perfect food for them. It's perfectly balanced for their rapid growth and development.
And it's fascinating how it changes over time, too.
Yeah.
But let's say that a mother is not able to breastfeed or chooses not to.
Mm-hmm.
What would we recommend in those cases?
In those cases, we recommend iron-fortified infant formulas. They are really designed to mimic the nutritional composition of breast milk as closely as possible.
Oh, wow.
And a key point here is that cow's milk is not a good substitute for these babies until after their first birthday.
Really?
Yeah, their little digestive systems just aren't ready for it.
That's so interesting. So much to think about, even just in infancy.
Right.
But what about when they start transitioning to solid food?
Oh, yeah, that's a big one.
Huge.
What do we need to know about that?
So we can usually start introducing solids around 6 months of age when babies show signs of readiness, like good head control or the ability to sit up.
Oh, that makes sense. And we have to be careful when we're introducing these new foods. We want to do it one at a time to help identify any potential allergies.
Wow. So it's like
being a food detective.
Yeah.
You know, watching for any reactions like rashes or fussiness or digestive upset.
Wow, I never thought about it like that.
It's an important job.
It is. It's a big responsibility.
Yeah, and by their first birthday, they should be eating a variety of table foods with different textures. And we want to really emphasize iron-rich foods at this stage to support their continued growth.
Oh, that's a good tip. Now, toddlers and preschoolers, I feel like every parent I know struggles with this.
Picky eaters.
Yeah, they're just notorious for having such erratic appetites.
Yeah.
Like one day broccoli is their favorite food, and the next day they won't even touch it.
I know. It can be so frustrating.
It is. So what do we tell parents who are dealing with this?
So it is a common challenge. You know, their growth rate has slowed down compared to infancy, but they're still incredibly active. They're building muscle and bone.
That makes sense.
And as nurses, we can really help parents understand appropriate portion sizes. And we can give them guidance on creating these healthy mealtime routines.
Okay, so routines are important.
Yeah, and also addressing any concerns about using food as a reward or punishment.
Oh, right.
Because that can create unhealthy associations with food.
Yeah, so we're laying the foundation for lifelong eating habits at this stage.
Right.
So as children then enter school, their energy needs increase again.
Right.
And now they're exposed to a whole new world of food influences.
They are, especially advertising.
Oh, yeah, that's true.
Yeah, so it's a really good time to talk to families about media literacy and making healthy choices, even when they're surrounded by all these less nutritious options.
Yeah, makes sense.
And, you know, school lunches and cafeteria food also play a big role.
Yeah.
And this is where nurses can advocate for healthier options in those settings.
Well, that's a great point.
It can make a big difference.
So now we get to adolescence, and I feel like
the teenage years.
Yeah, a time of rapid growth, spurts hormonal changes, developing independence.
So many changes.
So many changes.
Yeah.
And their nutritional needs just skyrocket.
Absolutely.
But they're also facing so many unique challenges at this age.
Right.
What do we need to be looking out for?
Well, we need to be aware of the prevalence of weight consciousness and eating disorders.
Oh, yeah.
Particularly in girls. Early identification and intervention here are crucial.
That's a really good point. And just the impact of their busy schedules, peer pressure, easy access to fast food. It's like a recipe for
disaster.
Yeah, it's a tricky balancing act.
It is. But as nurses, we can equip teenagers with the knowledge and the skills they need to make informed decisions about their diets, even amidst all those temptations.
Yeah, that's a good point. And then we move into adulthood, and now growth stops.
Right.
and our metabolism naturally slows down.
It does.
What does that mean for our nutrition?
Well, it means we need fewer calories to maintain our weight, and it becomes increasingly important to make healthy food choices and stay physically active to avoid weight gain.
That's a good point. And of course, pregnancy and lactation bring their own set of nutritional demands.
Absolutely.
What are some of the key things that we need to know there?
So during pregnancy, both the mother and the developing baby have increased needs for calories, protein, iron, and folic acid.
Oh, wow.
Folic acid is especially crucial for preventing certain birth defects.
That's really important information.
It is. And then during lactation, calorie needs are even higher than during pregnancy.
Really?
Yeah, to support milk production and ensure the quality of that breast milk.
It's amazing what our bodies can do.
It is.
But then we enter older adulthood. What shifts happen then?
So as we age, our energy needs continue to decline.
Okay.
And we often see changes in digestion and absorption. The senses of taste and smell might diminish, which can impact appetite. And then we have to consider the impact of chronic illnesses or medications on nutritional status.
It's like a puzzle.
It is. It's complex.
Yeah, figuring out all the pieces.
Right. And we can't forget about the social aspects.
Oh, yeah. What do you mean?
Well, social isolation or limited income or difficulty accessing and preparing food.
Oh, that makes sense.
Those can all contribute to nutritional deficiencies in older adults.
So we're looking at the whole picture,
Exactly.
the whole person, their medical history, their lifestyle, their social context.
Absolutely.
It's not just about the food on their plate.
It's about so much more than that. And there's even more to consider. We've talked about how nutritional needs vary across the lifespan,
Right.
but there are other factors that come into play, like biological differences between men and women.
Oh, that's true. So, for example, how would those needs differ between men and women?
So men tend to have more muscle mass, which
yeah.
requires more calories and protein, and women of childbearing age have higher iron needs.
Right, because of menstruation.
Exactly.
Okay, that makes sense.
Yeah.
And then we also have to think about the impact of chronic illnesses.
Yes, absolutely.
So like diabetes, renal disease,
Yeah.
heart disease, all of these can really change nutrient requirements.
They can. And mental health can also influence a person's nutritional status.
Oh, in that way.
So conditions like depression or confusion
Yeah.
can lead to decreased appetite and food intake.
That makes sense.
Ah,
Then we have alcohol and medications.
right.
What do we need to know about those?
So alcohol can interfere with nutrient absorption,
Claire?
while certain medications can interact with nutrients impacting their effectiveness or leading to deficiencies.
Oh, wow. That's something I hadn't really thought about before.
It's an important consideration, and that's why it's crucial to gather a thorough medication history,
Okay.
including over-the-counter drugs and supplements.
Even supplements.
Even supplements, because even seemingly harmless herbal supplements can have unexpected interactions.
Wow, that's really important. So we've got this complex web of biological, medical, and lifestyle factors all influencing a person's nutritional status. I can see how it all ties together now.
It's a fascinating interplay of factors.
Yeah.
And let's add another layer to this intricate tapestry, the influence of sociocultural and psychosocial factors.
Okay, and we see those coming up in Susan and Charles's cases as well.
Exactly.
So as nurses, this is where our skills really shine.
Right.
We're not just looking at a chart. We're understanding our patients' lives beyond that.
Absolutely.
So tell me more about these sociocultural influences.
Well, consider the social determinants of health.
Okay.
Factors like economics, access to food education, and support systems.
Right.
These can significantly impact a person's ability to make healthy choices.
So, for example, how would economics play into that?
Well, someone struggling financially might have limited access to fresh produce,
Oh, that's true.
or they might rely on cheaper, less nutritious options.
That makes sense.
And limited health literacy can make it difficult to understand nutrition labels or make informed decisions about dietary supplements.
That's a great point. And then we also can't forget about the role of culture and religion
Absolutely.
in shaping dietary practices and beliefs about food.
Right. For example, some cultures have specific food practices during pregnancy or illness,
Oh, yeah, that's right.
while certain religions prohibit the consumption of particular foods.
That's true. So it's important to be aware of all of those different cultural and religious practices.
Absolutely. And even personal feelings and meanings associated with food, like comfort foods or emotional eating or body image concerns, can impact choices.
Yeah, so it's really about understanding the whole person.
Food is so much more than just fuel.
Yeah, that's true.
It's tied to cultural identity, emotional well-being, and social connections.
It's all interconnected.
Exactly. And for Charles, understanding his cultural and religious perspectives on end-of-life care and nutrition will be crucial in supporting his decisions about his wife's care.
It's a really good point.
Okay.
So we've laid the groundwork, we've got the building blocks of nutrition, and now we've looked at all these factors that influence food choices and nutrient needs.
Right. We've covered a lot of ground.
We have. But now it's time to put on our detective hats.
Ooh, I like it.
Because we've got to figure out how we as nurses actually assess our patient's nutritional status.
It's time to gather the clues.
Let's get started.
I'm ready.
Okay, so we've talked about how important a holistic nutrition assessment is.
Right.
But what tools do we use to gather those clues?
Well, we use a combination of methods to
Right.
get the most complete picture.
Okay.
So one common approach is the 24-hour recall.
The 24-hour recall.
Basically, we just ask the patient to tell us everything they've eaten and drank in the past 24 hours.
So just from memory.
Yeah.
But isn't memory a bit unreliable?
I feel like I can barely remember what I had for breakfast this morning.
You're right, it's not a perfect method. People forget things, underestimate portion sizes.
Okay, so we need some other tools in our toolbox then.
We do. For more detailed assessment, we can use food diaries or calorie counts, where patients track everything they consume for a specific period,
Oh, okay.
like maybe a week.
Oh, wow. Yeah, that would be pretty eye-opening.
It can be. It's a powerful tool for self-awareness and behavior change.
We also have the food frequency questionnaire, which
Right.
asks about how often they eat certain foods over a longer period.
Oh, okay. So like a long-term kind of look.
Exactly. It's helpful for identifying potential deficiencies or excesses in specific nutrients.
Okay, that makes sense.
And, thinking back to Susan.
Yeah, our pregnant nursing student.
Yes. For her, that detailed food diary
Yeah.
was crucial in understanding the severity of her weight loss and the impact of her nausea and vomiting.
So it helped us pinpoint the problem.
Exactly. And guide interventions.
Okay, that's a good example.
Yeah.
So beyond dietary intake, what other assessments are essential? I've heard of BMI, but I'm not really sure what that tells us.
So BMI stands for Body Mass Index.
Okay.
It's a measure of body fat based on a person's height and weight.
Okay.
And it's a good indicator of whether someone is underweight, overweight, or obese.
So it's a screening tool.
It is. It's a way to screen for potential weight-related health risks.
Okay.
But it's not a perfect measure.
Yeah, I was going to say, are there any limitations with that?
Yeah. For example, it doesn't differentiate between muscle mass and fat.
Oh, that's a good point.
So a very muscular person might have a high BMI even though they're not overweight.
Okay.
It's just one piece of the puzzle.
Got it.
We also measure waist circumference,
Waist circumference.
which gives us an idea of abdominal fat.
And I've heard that abdominal fat is particularly risky for certain health problems.
You're right. Excess abdominal fat is linked to a higher risk of heart disease, stroke, and type 2 diabetes.
Oh, wow. So those measurements are really important.
They are.
Okay, so we've got dietary assessments, BMI, waist circumference. What about physical exams? Can those reveal anything about nutritional status?
Oh, absolutely.
Really?
Yeah, during a physical exam, we're looking for signs of nutrient deficiencies or excesses.
Like what kinds of signs?
So we check the skin, hair, and nails
Okay.
for any dryness, brittleness, or unusual pigmentation.
Okay.
These can be signs of deficiencies in certain vitamins or minerals.
So even something as simple as dry skin could be a clue.
Exactly. It's a clue.
Wow, that's interesting. What else are we looking for?
We examine the mouth for sores, inflammation, or changes in the tongue,
Okay.
which can be a sign of deficiencies in B vitamins or iron. And we assess muscle mass and strength,
Okay.
looking for any signs of wasting or weakness.
So we're using our observation skills.
We are.
Okay, and then finally we have lab data.
Yes. The blood tests.
The blood tests. What do those tell us?
So blood tests can provide valuable information about specific nutrient levels, like iron, vitamin D, or protein.
Okay.
We also look at markers of overall health, like blood sugar and cholesterol, which can be affected by dietary habits.
So we're gathering all this information from multiple sources
They are.
to really get a complete picture of what's going on.
Exactly, like building a comprehensive case file for each patient.
I like that analogy.
Yeah.
Okay, so we've gathered all this data, but now how do we actually use it to help our patients?
That's where our nursing interventions come in.
Okay.
The goal is to help patients meet their individual nutritional needs and improve their health outcomes.
I'm excited to learn about these strategies. Where do we even begin?
Well, sometimes the simplest interventions can make a world of difference.
Okay.
Like strategies to stimulate appetite.
Oh, like offering appealing food choices or creating a pleasant mealtime environment.
Exactly. Even small things like minimizing distractions or controlling odors or ensuring a comfortable position can significantly enhance a patient's desire to eat.
It's all about the experience.
It is. Creating that positive dining experience.
I like that. And then what about those times when patients need help with eating?
So assisting with feeding is a crucial part of nursing care,
Okay.
especially for patients with limited mobility, dementia, or dysphagia, which is difficulty swallowing.
Right. So we need to be extra cautious with those patients.
We do to prevent aspiration,
Aspiration.
which is when food or liquid enters the airway.
Oh, that's dangerous.
It can be very serious.
Yeah. Okay. So for patients with dysphagia, what do?
We modify the texture of food and liquids to make swallowing safer.
Okay. How do we do that?
We might thicken liquids, puree foods, or offer softer options. And offering encouragement and support throughout the meal can go a long way.
Oh, that makes sense. Yeah, just that positive reinforcement can make all the difference.
Mm.
And what about different types of diets? I know hospitals have a whole menu of options.
They do. There's a whole menu of therapeutic diets tailored to specific medical conditions.
So like a low-sodium diet for hypertension or a high-fiber diet for constipation?
Exactly. And for patients with diabetes, we have consistent carbohydrate diets
Okay.
to help regulate blood sugar levels.
It seems like there's a specialized diet for almost everything.
Almost. And it's crucial to collaborate with a registered dietitian when planning and implementing these diets.
Right. They're the experts.
They are. They're the nutrition experts.
Okay, so we're working as a team.
Teamwork makes the dream work.
I like it.
Mm-hmm.
But what happens when patients can't eat by mouth at all? Maybe due to surgery or a swallowing disorder.
That's where enteral and parenteral nutrition come in.
Okay, tell me about those.
So enteral nutrition involves delivering nutrients directly into the gastrointestinal tract.
Okay.
Through a feeding tube.
So bypassing the mouth and esophagus?
Exactly. We use different types of feeding tubes depending on the patient's needs and how long they'll need it.
Okay.
So a nasogastric tube, or NG tube, is common for short-term feeding.
Good.
It's inserted through the nose and down into the stomach.
Makes sense.
For longer-term feeding, we might use a percutaneous endoscopic gastrostomy, or PEG tube.
Okay.
That one's surgically placed directly into the stomach through the abdomen.
Okay, that sounds a little more involved.
It is.
So for both of those, are we talking about like a special liquid food going through those tubes?
We are.
What is that like?
So we have a variety of enteral feeding formulas,
Okay.
each with a different nutrient composition to meet individual needs.
Oh, wow.
Some are specifically designed for patients with conditions like diabetes or kidney disease.
So it's like personalized nutrition.
It is delivered straight to the source.
Wow, that's amazing. What about those cases where even enteral feeding isn't possible? Maybe because the GI tract isn't functioning properly?
In those situations, we turn to parenteral nutrition,
Okay.
which delivers nutrients directly into the bloodstream.
Wow. So we're bypassing the digestive system entirely.
Parenteral nutrition is a lifesaver for patients who can't absorb nutrients through their GI tract.
That makes sense.
Hmm.
So with all of these different methods, what are some of the practical things we need to keep in mind? What should nurses be aware of when we're managing these feedings?
So with enteral feeding, we monitor tube placement.
Okay.
We administer the feedings, assess for tolerance, and prevent complications.
Like what kind of complications?
Well, one concern is aspiration.
Right, especially with NG tubes.
Especially with NG tubes, we need to be vigilant about checking tube placement and keeping the head of the bed elevated during feedings.
Okay, so we want to make sure that food is going to the right place.
We do. We want that nutrition going to the stomach, not the lungs.
Right, exactly.
Another concern is diarrhea, which can happen if the formula is too concentrated or delivered too quickly.
So we're making adjustments as needed.
We are.
What about parenteral nutrition? Are there any specific challenges there?
So parenteral nutrition is more complex to manage. It involves intravenous access and carries a higher risk of complications,
Okay, like what?
like infection or electrolyte imbalances.
So it's really reserved for those situations where it's absolutely necessary.
Exactly.
Okay. And with both enteral and parenteral nutrition, are there any other things we should be watching out for?
Yeah, we closely monitor lab values, intake, and output, and the patient's overall response.
Okay.
Make sure they're getting the nutrients they need and staying safe.
It sounds like nurses really play a vital role in all of this.
We do. We're ensuring that patients receive appropriate nutrition and support during these specialized feedings.
And let's not forget that providing nutrition, especially in these complex situations, often involves ethical considerations.
Right. You're absolutely right.
Like we see with Charles and his wife.
Exactly. Charles is struggling with the decision of whether to continue tube feeding for his wife,
Right.
who has advanced dementia.
Yeah, it's a tough situation.
That's a very difficult situation.
Yeah.
The decision to initiate, continue, or withdraw artificial nutrition, whether it's enteral or parenteral, can be incredibly challenging.
It is. So what factors should nurses consider when they're supporting families facing these decisions?
Well, we need to respect the patient's wishes.
Oh.
If known and prioritize their quality of life,
Yeah.
we also need to be sensitive to the family's values and beliefs and provide them with accurate information.
Right, so they can make informed choices.
Exactly. It's about facilitating open communication and addressing their concerns, helping them weigh the benefits and burdens of these interventions.
It's a delicate balance.
It is.
Yeah.
And our role is to provide compassionate guidance and advocate for both the patient and their family.
Okay, so we've covered a lot of ground, from assessing nutritional status to implementing interventions, including those really specialized feeding methods. We've even touched on the ethical considerations that can arise. I feel like my nutrition knowledge has just expanded significantly.
You've been an excellent student.
But before we wrap things up, there's one more aspect we need to discuss.
Okay.
And it's one that's often overlooked, but it's incredibly important.
What's that?
Well, remember that you as future nurses are also susceptible to the same nutritional challenges and influences we've been talking about.
Oh, that's true.
Your own well-being matters too.
It does. We can't pour from an empty cup.
Exactly. It's essential to practice what you preach.
Right.
Make healthy food choices, manage stress, get enough sleep, and stay active.
Self-care is not just a buzzword.
It's essential.
It's essential for being the best nurses we can be.
You got it.
It's easy to get caught up in the whirlwind of it all.
Oh, it is. Classes, clinical studying.
Absolutely. Long shifts, irregular schedules.
Yeah.
All of that can disrupt our eating habits.
It's so true. I know I've definitely been guilty of grabbing fast food or even just skipping meals altogether when I'm short on time.
It happens to the best of us. But we have to remember that our own nutrition impacts our energy levels, our focus, and even our immune systems.
Right. We can't provide the best possible care to our patients if we're running on empty.
Exactly. So what are some practical steps that nursing students can take to really prioritize their own nutrition amidst all the chaos?
Well, I think meal planning is a lifesaver.
Oh, yeah.
If you can take some time each week to plan out your meals and snacks,
Yeah.
it can really prevent those last-minute unhealthy choices.
I love that idea. And prepping some ingredients or even full meals ahead of time
Yeah.
can make healthy eating so much easier during those busy weeks.
It's like setting yourself up for success.
Exactly.
And having nutritious snacks on hand is essential.
Oh, tell me about it.
I always keep nuts, fruit, or yogurt in my bag for those long clinical days.
Smart move. Those snacks can help prevent those energy crashes and keep you going until your next meal.
Exactly. And hydration is so key.
Oh, it's essential.
It's easy to forget to drink enough water, especially when we're so focused on patient care.
You're right. Dehydration can lead to fatigue, headaches, even difficulty concentrating.
Yeah.
So keep that water bottle handy and sip on it throughout the day.
That's a great tip. I've also found that just being mindful of portion sizes is really helpful.
Oh, yeah.
It's easy to overeat when we're stressed or tired.
That's a great point. And paying attention to our hunger and fullness cues
Yes.
can prevent that mindless eating.
Yeah. And let's not forget the importance of self-compassion.
Absolutely.
We're all human.
We are.
We're going to have days when we don't eat perfectly.
It's not about perfection.
Yeah.
It's about making sustainable choices.
Exactly.
Choices that nourish our bodies and minds.
So we've covered a lot of ground in this deep dive on nutrition. We explored the fundamentals. We connected them to real-world nursing scenarios. We even tackled those complexities of specialized feeding methods.
And we emphasize the importance of holistic assessment, recognizing that nutrition is intertwined with so many aspects of our patients' lives.
And we highlighted the critical role nurses play in providing education support and advocacy, empowering our patients to make informed decisions about their nutritional well-being.
And just as we care for our patients, we must also care for ourselves.
Right.
Recognizing that our own health and well-being are essential for providing the best possible care.
Future nurses, remember this. Nutrition is a journey, not a destination. It's a continuous process of learning, adapting, and making choices that support both your patient's health and your own.
Keep asking questions, stay curious, and never stop exploring this fascinating world of nutrition.
Thanks for joining us on this deep dive. We'll see you next time for another insightful exploration.